Okay, look at this case scenario. A 48-year-old woman is admitted to surgical casualty ward with fever for 5 days and right upper quadrant pain. Blood investigations show a CRP of 56. An ultrasound scan is performed and it's consistent with acute cholecystitis. Intravenous fluids are given and we are asking what additional treatment or treatments is the patient most likely to have next. We are given 5 options here. Option A, analgesics, IV antibiotics, laparoscopic cholecystectomy 6 weeks after discharge. Option B, analgesics, laparoscopic cholecystectomy within 24 hours of admission. Option C, analgesics, IV antibiotics and laparoscopic cholecystectomy within 1 week. Option D, analgesics, open cholecystectomy within 24 hours of admission. And the last option is analgesics, intravenous antibiotics and repeat ultrasound after 6 weeks. Hey everyone, today we'll discuss about acute cholecystitis. So what is acute cholecystitis? It is the inflammation of the gallbladder, most probably secondary to gallstones. And a gallstone goes and impacts at neck of gallbladder. And there's continuous right upper quadrant or epigastric pain and it usually referred to right shoulder. So these are the must-know things you should know about acute cholecystitis. So this is a graphical illustration of your biliary tract and your alimentary canal. This is liver and this is the alimentary canal. This is gallbladder. There are a few gallstones in there, duodenum, common bile duct, cystic duct and pancreas. So like this, in this diagram, a gallstone that is inside your gallbladder goes and impacts on the neck of the gallbladder and therefore it causes obstruction. And due to that, the intraluminal pressure inside the gallbladder increases and therefore inflammation occurs. The gallbladder is getting edematous and inflamed. Therefore, the term acute cholecystitis, inflammation of the gallbladder. Clinical features of a patient presents you with acute cholecystitis. Obviously, there is vomiting, fever and local peritonism can be there. Sometimes there is a palpable right upper quadrant mass. And keep in mind that the Murphy's sign is positive in acute cholecystitis. I hope you remember the Murphy's sign. That is when you place your hand in the right upper quadrant and ask the patient to breathe in. And when the patient inspirates, the gallbladder, the inflamed gallbladder comes and hits at your hand. And due to that, there's a sudden increase in pain occurs and therefore the inspiration arrests. So this is how you elicit Murphy's sign. Now we see what are the investigations you can do. WBC count is elevated and usually their C-reactive protein is getting elevated. And in ultrasound scan you can find a thick wall and shrunken gallbladder. And sometimes there can be a mild derangement of the liver function test because if the gallstone goes and impacts in the common bile duct and that can lead to Medici syndrome and that can create alterations in your liver function test. So these are the investigations you do. Now we'll see what is the management. You can keep the patient ill by mouth and if the patient in pain you can give analgesics and IV fluids is a must and IV antibiotics is also a must. And please keep in mind that the most important thing in management of acute cholecystitis is laparoscopic cholecystectomy after 1 week of symptoms. This is the point I want to give you throughout this presentation. This is an area where it's questioned mostly in your exams. So keep in mind that you can do according to the NIVAS guidelines laparoscopic cholecystectomy after 1. So now we'll get into our MCQ. So obviously you can see the answer here is answer C, that is analgesics, IV antibiotics and laparoscopic cholecystectomy within 1 week. So that's all about acute cholecystitis. I hope you like this short revision guide about acute cholecystitis. So we'll meet in another revision guide like this. Please like and share with your friends and don't forget to subscribe my YouTube channel for more videos like this.